If you desire to have a clear, glowing, vibrant, even skin tone, smooth, textured, less pores or no pores, then this dream skin can be achieved with exfoliation. Exfoliation is the secret to get a skin which is a celebrity skin or a Korean glass skin. And today I'm talking about exfoliation. Hello friends, I'm Dr. Geeta Grewal, cosmetic surgeon and founder of 9 Muses Wellness Clinic and 9M Skincare. My job is to make you look pretty, beautiful and vibrant. Today I'm talking about exfoliation. What is exfoliation? How to do exfoliation? What are the benefits? Who should avoid? How many times to do? And if there are any side effects, how to handle that. So let's get started. Exfoliation is nothing but removing the dead cells. If you see a tree bark, a very old tree bark, the top is very rough. The carpenter, removes these dead cells and gives this finish. Exactly, this is exfoliation. The top layer of the skin is a lot of dead cells and they are lackluster. They are giving uneven skin tone. They make your skin look dull. They are sticky. They decrease collagen in your skin because they cause collagen breakdown. They prevent what all vitamins that you're using, what all expensive creams you're using, but it is not actually reaching the cell where it has to function. So if there are dead cells on your skin, it's like throwing away those products in the dustbin because it will not reach the cell. Exfoliation is the most important step so that your daily skincare reaches the cell and the cell can use these vitamins and antioxidants. What are the benefits of exfoliation? It will remove the dead cells. It will give that shiny baby skin coming up, so it will give you that nice, smooth, glowing skin. It will stimulate your collagen formation. It will shrink the pores because it is deep cleaning your pores as well. So your pores will get smaller and tighter and your collagen will boost. So overall, it will help in anti-aging your skin, giving you smooth texture, even skin tone, plump looking skin, boost your collagen, decrease your pigmentation and shrink your pores. When your collagen is good, also your utility of all your skincare becomes better. The results from your skincare also improves. How to do exfoliation? You can do exfoliation at home. You can do exfoliation in clinic. In clinic, of course, it is way superior to what you can do at home, but best is combination. There are physical exfoliants, there are chemical exfoliants, organic, inorganic exfoliants. The chemical exfoliants are AHA, BHA serums. You all know they cause removal of the dead cells. The sticky dead cells get separated and they shed off. That's why immediately you see a smooth touch to your skin whenever you touch your skin. And over a period of time, you'll see the fine line wrinkle going down, pigmentation going down, and the skin becoming more plump and more dewy. At home, you can use various scrubs. I can share few things with you like oatmeal and coconut curd. You can use castor sugar with honey. You can use besan with curd. This will help in exfoliating. Make sure whatever you're using, the granules are very tiny because if the granules are big, they can give a cut in the skin and that can cause rash or inflammation in the skin that can cause damage to your skin. So avoid thick granules but go for fine granules, do fine circular movements, small circular movements so that the dead cells can be removed, as well as you're moisturizing along with the removal. So the benefits of exfoliation get multifold. In clinic, you can go for laser peels that help in removing the dead cells, and also on face, different skin zones are of different the intensity of dead cells. So in clinic, every zone can be taken care, whereas at home it is uniform. In clinic, we can customize the treatment according to the skin depth, the skin thickness, and exact exfoliation can be done without giving any downtime. Certain myths around exfoliation, that exfoliation can make your skin thin, which is wrong. Exfoliation will remove hair, that is wrong. Exfoliation will make you purge, not really. If it is very correctly done, it will not cause any purging. But yes, you have to be taking your skin type consideration. If you have a dry skin, go for cream-based exfoliants. If you have oily skin, go for gel-based exfoliants. If you have oily skin, go for salicylic, glycolic acid. If you have dry, go for lactic acid. So depending on your skin type, if you choose an exfoliant, you will get a better result and you will get a positive result rather than a side effect. Then you'll get scared and you will stop exfoliating. So don't stop exfoliating. Understand your skin, understand the skin dynamics, and use different exfoliants. Let me know if you have done exfoliation with any of these chemicals that I named, and if you have faced any challenge, I'll be more than happy to answer your questions on this. Who should do exfoliation? Exfoliation should be done by everybody. In your teens, I think you should start, because the moment the hormone kicks in, the skin starts the skin is in different dynamics. The whole process of skin cycle changes, the issue of clogged pores, all this starts. So teenage is the best age to start exfoliation. But yes, less in teenage, and as you go further, maybe in your 40s you are doing once in a week. In teenage you're doing once in 2 months, and in between you can do once in a month, or once in 3 weeks, or once in 2 weeks. At home scrubs you can do once in a week, and in clinic you can do once in a month, because skin cycle is once in a month. All skin types should do exfoliation: dry skin, dull skin, pigmented skin, with acne, without acne, acne scars, open pores, whiteheads, blackheads, pigmentation. Everybody should do exfoliation to improve their skin health and let the skin breathe, and let the skin get all the nourishment from your serums and antioxidants that you're using on day-to-day basis. But before you start exfoliation, you must have a routine, that is moisturizer and sunscreen, because exfoliation is an important step. It is also a step which needs a certain basic things, basic skincare in place before you start exfoliation. Like your moisturizer should be there, your SPF should be there, you should be regular with your evening and morning skincare routine. Only then you'll move towards exfoliation. Start small, and then slowly every time you add one thing. Like you're doing glycolic acid, do glycolic one day, give your skin a rest for a month. Next time you do glycolic twice a month. So slowly you increase your exfoliants, and you will see the improvement in collagen, in uneven skin tone, in collagen buildup, in strengthening your skin, making your skin more plump, decreasing the pore, decreasing the uneven skin tone, decreasing the pigmentation. All these benefits you will start seeing over a period of time. Ideally, it takes 3 to 4 months of skin cycle, that is 3 to 4 months, to start seeing substantial benefit after you're introducing any kind of a skincare. So don't jump to the conclusions very quickly. Be consistent, be disciplined. Who should not do exfoliation? If your skin is very sensitive, you have acne, then of course don't try it at home. If you have any skin infection, don't do it that time. If you have not your basic skincare in place, then also don't do. If you're not using moisturizer, sunscreens regularly, don't do exfoliation, because exfoliation will harm your skin, because it will sensitize your skin to sun damage, and you will cause harm because you're not going to put moisturizer and SPF, which are supposed to protect the skin and repair the skin after exfoliation. So these steps you must follow when you are doing exfoliation. According to the skin type, how frequently you should do exfoliation. If you have oily skin, you need to do once in a week. If you have a sensitive skin, once in a month. If you have a combination skin, then once in 2-3 weeks. That will work the best. And start early so that you have good skin throughout and you never face the sun damage issues like developing pigmentation and uneven skin tone and dull skin, lackluster skin. This is actually you're starting late. So first you have to correct this damage and then you see the benefits. So if you start at a right age, in your teenage and early 20s, you will see you will not reach a level of getting that photo damage, sun damage in your skin if you're consistent and disciplined with your skincare. Now, what are the side effects of exfoliation? You started exfoliation very enthusiastically. You have taken too much of product. You want to get quick results and you have done too much of glycolic or very high percentage of glycolic. You will get a side effect. So start slow. What kind of side effects you will see? You will see itching in your skin. You will feel peeling. You will see flaking. You will see tightness, especially on the corners, and cracking in your skin. Sometimes even you can bleed from those cracks. So redness, itching, burning, stinging, all these can happen if you're over exfoliating or you're not exfoliating properly. How to handle this? Immediately stop. Don't put any actives. Stop your glycolic, retinol, salicylic, vitamin C. Stop all your actives when you have any of these signs that I've told of exfoliation, and start hydrating your skin. Use hyaluronic acid, use aloe gel, use panthenol, use allantoin, use Asiatica, Centinella Asiatica products. All these ingredients, they will help in soothing your skin, calming your skin, and then you can slowly again learn about exfoliation and give it a try and do it wisely. A commonly done mistakes that I have seen in exfoliation is you're doing it too frequent and you're doing exfoliation with a very high percentage, or you're using suddenly too much of product. I had a patient, she squeezed the whole tube in one day because she thought she'll get faster results. It doesn't happen like that. Use a small amount, moisturize your skin, do it on a wet skin, never do exfoliation on a dry skin, because dry skin, the product will rush through, it will seep the skin very fast, whereas oily skin, the oil creates a barrier. At those places, the peeling agent will not pass, or your actives, glycolic, salicylic, will not seep in that well, whereas on the dry spots, the peeling will go very fast and it will backfire by giving you dryness, itching, redness, burning, stinging, and all the signs that I just told you. Let me know if you have experienced any of these things, and we can do your hand holding and understanding your skin dynamics, so you can be a pro. But give yourself time in understanding your skin, because skin is dynamic. It is constantly changing with day, night, evening, afternoon. The skin is different. Indoor skin is different, outdoor it is different. So skin is very, very dynamic organ, and that's why it is exceptionally difficult to understand and customize every time. And because you kind of overlook it, so it's best you understand your skin type with your esthetician, with your doctor, and you understand and then move forward, and then you can take decisions about exfoliation on your own over a period of time. So anytime you get any reactions from exfoliation, stop your actives, start allantoin, aloe vera, hyaluronic, niacinamide, Centinella Asiatica, panthenol. All these will help in soothing your skin, calming your skin, and you can then restart after you're more confident. Do like and subscribe. I hope you learned something new about exfoliation today, and share your views about the video, what more you want to know. I'll be happy to make more such videos on the content you demand, and share it with your friends who may find it helpful. See you. Take care till then.